You've alluded previously to these improvements that science and technology has brought to the field of medicine. It happens all the time. How do you keep up with those changes? And do you take courses? Do the manufacturers come in and teach you?
A little bit of both. For example, when it comes to balloon sinuplasty, which we've probably been doing here for 10 years or more, when the original balloons came out, we actually did some training. But I say we because my partner, Dr. Livingston, and Dr. Yoon also do the procedure. And as those technologies have changed, for example, we now have computer-assisted guidance. If I were going to operate again on that right cheek sinus that I talked about, I now can use your CAT scan, load it into a computer, and using a device that we place on your head, we can actually align your CAT scan with your sinuses. So I have a roadmap for your sinuses as I'm performing that. So that was learned in part by going to a class to learn about that, in part by just using the machine over and over. But yeah, you have to stay on top of the newer technologies because there are all kinds of new procedures coming out for different ENT problems.
Yeah, well, you mentioned the scoping with a little camera. Way back when I was doing work in laser and optics involved in medicine, in gastroenterology, it was a fiber optic endoscope that you could look through. But the frustration that they had was that they could see the problem, but they couldn't do anything about it. What I did was help them using a laser and a fiber optic to stop the bleeding.
Right.
Nowadays, there's a camera that goes in there and looks around. I mean, things have changed very rapidly, and you have any thoughts on what might be available to patients in the future? What's coming along? You don't have to. You don't have to.
You know, one of the most common questions I'm asked is there ever going to be a cure for hearing loss? And when I was in residency, I actually did some research on, trying to determine if we could get the hair cells in our inner ear to redevelop. We hear basically through sound traveling through the ear, hitting the eardrum and amplifying through what we call the middle ear into the inner ear where the hair cells are. These hair cells are responsible for getting the signal to the brain. Most cases of hearing loss, what we call sensory neural hearing loss, are due to damage to those hair cells. I'm hopeful that sometime in the future that we will have the ability to regenerate these hair cells, similar to the spinal cord injury research and how neurons are, people are working to try to get neurons to grow so that people can be, nerves can be damaged. Nerves are the most frustrating thing because they're the things that we are probably the least effective at treating at this point. But I believe that sometime in the next, I can't say how many years, I hope 20 plus years, that we'll see a lot more research and improvements on, repairing nerve damage in whatever part of the body that is.
Oh, excellent. Now, we've covered many, many matters. One thing I want to get to before we finish, you'd mentioned hearing aids earlier. The technology, again, has come a long, long way. How useful do you think they are? I mean, do they truly serve at the whole range of frequencies that you call good hearing?
Yes, I do think hearing aids are extremely helpful. I often say to patients, to me, there's a difference between hearing and listening. So when we were 10 years old and just sitting in classroom, you could hear what the teacher was saying. As we age and lose hearing, which most people, including myself, will lose some hearing in the higher frequencies, we have to work harder to listen. There's actually been studies that show that patients who have hearing loss will lean in and squint their eyes when they're listening because they're having to work to hear. And some of the newest research shows that because of that, it can cause some fatigue to the brain. So improving that hearing loss is an important part, I think, of brain health and cognitive health. I have seen in the years from, I mentioned I've been here 20 years, when I first was practicing, if I saw a patient who had a classic high frequency hearing loss, meaning they heard really well with the lower frequencies like the hum of refrigerators or the noise from a dishwasher, but when in a restaurant speaking with a bunch of people, we're missing a lot of voices, particularly female voices, which are higher frequency. Those patients were very hard to fit with hearing aids when I first started, but the technology has gotten better in that we now can better amplify the area where the loss is without crossing over into the area where the hearing is normal. So that the person who's going to a restaurant doesn't have to just hear the clank of the dishes and the plates next to them, but they can actually pick people's voices out of that, so they can better hear as opposed to just working to listen.
Oh, that's great to know, because none of us are getting any younger. Anyway, we've covered a lot of different issues. Your remarks have been very useful, I think. Is there anything more you want to add before we finish?
No, just that, again, we've been here on the Treasure Coast for, actually took over for a practice before ENT was here, and we have 3 physicians and a nurse practitioner. We have 3 audiologists who are also available to help and fit hearing aids and explain hearing loss. And I think that we have a comprehensive group here that can answer and take care of a lot of ENT problems.
Well, Dr. Baggett, thank you very much for helping out with getting this message out. And perhaps in the future we may do this again to refresh it.
And hopefully then we'll be able to shake hands because COVID-19 will be behind us.
Okay. This is Mike Bass for Targeting Your Health.